Hello, this is Carrie Smith on WRUU-LP Savannah, Georgia, 107.5 FM, WRUU.org. We are Savannah's Soundings Community Radio with Global Soul. The viewpoints expressed in the following program are not necessarily those of WRUU, its license holder, or its staff. The following program contains subject matter and realistic language that some listeners may find objectionable. Listener discretion is advised. This is Carrie Smith on the Verb Altitude Hour on WRUU. Today, I have myself, host Carrie Smith, and also in the house, the other host is Torvin Prestel. Torvin, thanks for visiting once again. Regular host here.
Not a problem. Thank you very much for having me again.
Torvin, you got a new baby here. 1 week old today.
Brand new baby, 2 weeks old.
2 weeks old. Dang, time flies.
Oh, yeah.
You know, I still have that single person syndrome. You don't. You're like married and have a kid just in the last year.
Yeah. Well, yeah. It's a completely different lifestyle. A lot of sleepless nights.
A lot of sleepless nights. All right. Well, talking about those sleepless nights brings us right into, got a new family, and I'm even on my end. We've got a lot to consider in our generation, and that is healthcare, which affects actually all Americans. And we're talking about the Affordable Healthcare Repeal Act that the Republican legislature is proposing in objection to what is normally called Obamacare, but happens to be the Affordable Care Act passed under the Obama administration. You know, what's really funny as we introduce this topic is that Obama's administration just happens to be the one that's been successful at making this come into play.
Very true. Is many administrations have tried and failed to get healthcare, universal healthcare, whatever you want to call it, as a law, and it has not happened. The political climate at one time or another just doesn't allow it to happen. Obama did get it done. I don't know how good of a bill it was in the end. It did have a lot of problems. Even he says that. So, but he did get it done, and I commend him for that at least.
You know, every president since President Nixon's executive administration has encouraged the legislature to pass a form of universal health care. Even going back to Nixon, Carter, Reagan, Bush Sr., Clinton, and Bush Jr.
Right.
Now, talking about previous presidents, the Clinton administration really had a strong focus on a community-wide healthcare initiative. Could you speak on that? I know you're more familiar with the Clintons than a lot of us are, being, more on the progressive-leaning Democratic side of things.
Traditionally, I like to think that I am a little more progressive, I would say. But in no way do I vote lockstep with Democrats. I think that's ridiculous, and a lot of their ideas are ridiculous. Sometimes, well, not, I won't say a lot of their ideas. Some of them are. But the Clintons did try to pass health care. Hillary Clinton was a big part of that, and she also failed. It made people really hate her on the other side of the political aisle. And, Hillary Care it was called. Mm-hmm. And she revamped Hillary Care for her campaign run against Barack Obama. And I did like the way that she set it up a little better than the way Obama set up Obamacare because of not having to pay a fine for not having health care. Mm-hmm. I feel like that really wasn't productive. It hurt a lot more people than it helped. It helped the insurance companies more than anything. The Affordable Care Act, I feel like, helps the insurance companies. It doesn't really help people that much. Even when you have health care, you can't afford to use it with a $5,000 deductible. Most people don't have $5,000 sitting around. So I did like that part of her health care plan, even though it wasn't a bill.
Mm. And really what we're talking about is insurance reform. So to make health care effective by introducing lower cost, more affordable premiums. to families and individuals.
Lower premiums, lower deductibles, and it's really complicated. Healthcare is a really complicated issue. If it was easy, it would have been done a long time ago. It's more than just lower payments and lower deductibles, but that's a big part of it for people. That's the kitchen table issue for people. How much is coming out of my pocket? How much am I taking away from my family to put in this healthcare? And essentially giving it to insurance companies. So I think the insurance companies should not be in the business of keeping America healthy. I think the government should be in the business of keeping America healthy. They already tell us we can't have too much of this, or we shouldn't do this, we should do that. There's a better way than the Affordable Care Act or Obamacare, and for that matter, Trump Care as it's currently proposed.
Yes, Trump Care. Well, the interesting thing here is the interesting concept of this whole idea of universal health care comes back to a core thought in this nation, and it brings us back to this concept of freedom and what is allowed, and what is allowed meaning, is it constitutionally a right? Is it a civil right, or is it a civil liberty? And when does the government infringe on those rights and those liberties? Throwing this iron in the basket here, I thought this would be a good moment to take into account where the historical roots of healthcare come into play in this country, and why is it a necessity to have healthcare in this country? Why is it important? So let's talk a minute on this point. In turn of the 20th century, we had a large issue with unfair practices, and we're talking about the Industrial Revolution, where after the Great Migration North, where most of descendants of slaves left in the Great Migration North, where a lot of African Americans went in search of jobs and higher wages, right?
Yes, exactly.
And
to escape racial persecution.
Exactly. And so higher well-being, higher living wage would afford them the idea to start thinking about the need for health care, and then the unfair social practices that come into objectifying people on the basis of labor. Then we're giving people a thought that no longer are we separating. Then we begin to separate this whole concept of what is right and what is a liberty and what is a right, and what should the employer produce and what should employer provide. So this comes into the conceptual idea of where I'm going with this thought is, is it the employer who is objectifying the laborer in a capitalist society, which we have also socialism today as offshoot from World War II, because we can't provide basic necessities, thinking about Maslow's hierarchy of needs. So we put that into a big bubble, and we talk about the America that we have today, and how did we start with our roots, going from the social reforms with labor unions fighting for rights in the workplace.
I do believe you're right.
Yeah.
A lot of it's about rights,
Mm-hmm.
and
That's
your liberty, your right that you are born with.
Mm-hmm.
Do you have the right to health care when you are first born? Is that a right, or is that a privilege? That is pretty much what did spark a huge revolution that got Obama into office and then gave him the political capital to pass a health care bill, even without the now needed 60 votes in the Senate. He did it with 2 Republican votes, Olympia Snowe and Susan Collins, and barely got it through because of the death of Ted Kennedy. Barely got it through, but did pass something. But people did pretty much come together and say healthcare is a privilege.
And
It's not a privilege. It is a right.
And that's the important conversation that we're having today. But it really has roots back in a lot of these social reform movements after, the whole civil labor union, the creation of civil labor unions at the turn of the century, coming out of the need to fight for these basic things. And healthcare was in that conversation. And that's when employers started thinking about providing healthcare, because before that in this country, before that moment took place, doctors, you would have to go to the doctor and pay out of pocket. Well, that would mean then those individuals who are of second class or lower third class to a middle third class would not be able to afford something as basic as healthcare. And we're not just talking about, prescription drugs like we have evolved today, basic preventative care like we have today. We're talking about just even as simple as before having clinics in this country and the Department of Human Services and having kids that are 17 years and younger being able to have basic care paid for through these clinics. That we didn't have a Department of Human Services that would do these things. Making sure your teeth are okay, making sure you have the availability to be able to see a nurse or a nurse practitioner or even a doctor at a clinic for a common cold.
It evolved from employer healthcare,
right?
Employer provided healthcare, and our system of healthcare up until the Affordable Care Act was that employer provided healthcare, and whoever was working there got it, plus their wife and their children, and then that created the marketplace for other people to come in, and they would have to pay a much higher premium because they were in the group that this worker happened to be in, with whatever union or whatever group he happened to be working with, to obtain this health care. So, but at no point, though, during that was health care affordable. Before the Affordable Care Act passed, and even still today, the number one reason for bankruptcy was having a major health issue. You pretty much, if you have a major health issue, you lose everything. You lose your house, your car, your job, maybe, and more than likely get divorced. I don't think that's necessarily fair, and a lot of people thought the same way, which is why people say, as we were alluding to earlier, that this is a basic right. But what are we doing when we're paying we're not just paying the doctors when we pay for this health insurance. We're paying insurance companies. The money is going to the doctors from the insurance companies. We're creating a big pool. They're giving a little bit to the doctors for the overcharging of services, and then they're keeping the rest of it for profits and saying they're doing a good job. I think we need to take the insurance companies completely out of it, and that way, and have government run healthcare. Period. That way we're not just supplying money to Wall Street. We're giving money directly to doctors who are constantly complaining about not being able to make enough money, not having enough money to cover themselves for insurance, as far as lawsuits and what have you. We need to get away from employers providing health care, I do believe, and I feel like we're going backwards right now with the current proposed healthcare plan, which I do not think is going to pass.
I'm in agreement. When I evaluate the Obama healthcare, and when I evaluate the Affordable Care Repeal Act, as it could be called several different things, but basically the Republican initiative to revamp Obamacare,
repeal and replace.
And talking about that, we're going to talk in the second segment, so I don't want to go off go off on a tangent here, go off subject too much on a tangent here. In the second segment about the inequalities of both the Obama Repeal Act and the Obama Healthcare Affordable Care Act, as we should say. So we're going to talk about those inequalities in the second segment. But what I really want to talk about, is it a right and is it a liberty? You've talked on this a little bit, but let's put our mindset in the fact that there's a lot more into this Obama healthcare initiative. So let's talk about some of the rising successes of the Obama healthcare initiative. Number one, the Obama healthcare initiative helped to solve issues for part-time employees to help have access to affordable health care.
Yep.
It also helped solve the inequalities for several individuals who are, in between regular work, being able to have some sort of health care. I'm talking about small business owners,
right.
Consultants, actors, persons like yourself who are in between gigs as a DJ.
Healthcare.gov.
Healthcare.gov. What about the other folks? Those with long-term diseases, or long-term, what is the word?
Pre-existing conditions.
Conditions are also included in this structure. And then America began to change its whole idea and its whole framework in response to the Obama healthcare initiative, which I will have to say, the Democratic legislation and the Obama administration did a really fine job of educating the community through grassroots operations, grassroots education in every community. I think, besides its media campaign to inform the public on what was going to take place, how is this going to affect them? I think this is very important.
I think they were very informative.
Mm-hmm.
Very informative. The product that they were informing us about, though, is less than palatable.
Yeah.
But they were very informative and let us know all the great things about it. But there are a lot of drawbacks.
Yeah, but the mentality has changed. American mentality regarding healthcare as now being a right. It's now a right rather than just a liberty. People believe today they have a right to health care.
Well, now that it has been given to people, whether you're a Democrat or Republican, people don't want it to be taken away.
Right.
But there are some people, though, when we're speaking about rights, who also have a right to not have health care.
Right.
And
right.
So we are. I do feel, and this is a big critique of Obamacare or the Affordable Care Act, we are forcing people who do have the right to say no to get health care. Now, do I feel like they should have the right to say no? No, I do not. I think it's ridiculous. But they, as it stands, they do have the right to say no. I don't want it, and they pay a fine for that. Now, they do drive up cost for everyone else, which is why I think it's ridiculous for them to say no. I think we should have pretty much a single-payer type of a system. I don't know. I haven't seen a single-payer plan that I feel like works. I haven't seen the Trump Care plan, and it's as far as how it works. So I'm waiting on the CBO score from next week. But I feel like it's going to be rated low just like the rest of them were. And I don't have a whole lot of faith in that. Well, we do need this. We do need health care. We just need to stop paying the insurance companies. We need to pay the doctors directly, pay the hospitals directly.
Well, people have a choice today. People now have the conversation between the choice between generic drugs and name brand drugs. A lot of drugs have shifted from being prescription drugs to being non-prescription drugs. A lot of companies have benefited from this healthcare initiative. Also, contraceptives are now included in healthcare plans, which was a major point to include this in the conversation among women in the legislature, knowing that this is a big point. And they had a lot of backlash. And we saw women in the legislature, public servants on both sides, women, both Republican and Democrat, organizing to fight some of the men in the legislature on this point.
Well, that's closing Planned Parenthood. Stop funding Planned Parenthood. Conservatives don't like Planned Parenthood.
I'm talking like going all the way back, back before this even became a thing.
Well, of course.
Right.
Well, of course.
But now we know that this is a right that women should have, regardless. We also understand that people working part-time should have access to an affordable health care plan. People are more educated than they were 8 to 10 years ago, right?
Certainly.
So we even know the difference between preventative care, and we also know the difference between emergency care. And of course we know this beforehand. We also
some people know this.
Some people, most people. Well, I guess I put myself in such a bubble because I'm around amazing, intelligent people that I call friends that are also partake in this radio show. But I think the biggest point is that the public now has a conversation that people call it a socialist health care plan. Really, you can go all the way back to lunch programs and call that a socialist health care program, or entitlement programs. All in between, what I'm saying is we are more educated than we were 10 years ago, and all of these things are very important factors that we now might take for granted, but once were struggles that people had a real hard time getting into a clinic, which would take 2 or 3 months in advance. So let's talk about this for just a split second. How did we come about to even having a healthcare initiative? First of all, the Supreme Court ruled and said, no, this is considered a liberty. We cannot make a right not to have to choose whether you want it or you don't want it. So the Supreme Court said you can pass this through tax code and mandate people to either decide to have it or not to have it. I'm putting it in layman's terms.
Right.
That you can pay a penalty not to have it, but we will give you that option. Basically, they could not require Americans past their civil rights to have this, based within the framework of the Constitution. You cannot force people against their will to sign up for this program.
That's what the Supreme Court.
Right, that was the Supreme Court ruling. Right. We're going to play a video from 2012 when we come back that was on CNN talking about this ruling to sort of refresh our minds. But we're going to go to a commercial break. And this is the Verb Altitude Hour on WRUU-LP Savannah, Georgia, 107.5 FM, WRUU.org. We are Savannah Soundings Community Radio with Global Soul.
WRUU Savannah Soundings Community Radio announces its second annual online auction. The auction will run from July 17th to July 30th, with proceeds going to Savannah Soundings Community Radio as an investment in the diversity of our community voice and music. The wide range of auction items from Savannah businesses will guarantee to delight and surprise. To join the online bidding fun, follow the link found at WRUU.org. This portion of WRUU-LP Savannah Soundings programming is made possible by a grant from Sentient Bean, offering fair trade coffee, vegan and vegetarian food, and breakfast all day. Located at 13 East Park Avenue, across the street from the tennis courts at Forsyth Park. Our menu and special events listings can be found at sentientbean.com.
Welcome back to the Verb Altitude Hour on WRUU Savannah. We are coming back and talking about the inequalities of both the Republican Health Care Repeal Act and the conversation that's going on in reference to the Affordable Care Act. We've been talking about the framework within the current healthcare initiative and some of its pitfalls and some of its successes. We're going to expand upon the inequalities of what has led to the conversation for the Republican Repeal Act, which is, as Torvin says, repeal and replace.
Repeal and replace.
So let's first talk about, before we get this video rolling, Mitch McConnell. He was the Republican who came out and said, let's really focus on supporting the Obama health care. Let's fix what's wrong with this instead of trying to repeal and replace. are you familiar with this conversation?
I am. I am familiar with his comments.
Okay, what are some of his comments, Torvin?
Well, those that you have just mentioned, and that comes after they could not pass a bill. The Republicans are really dropping the ball here. For what, 7, 8 years? They literally ran for 8 years on this repeal and replace. 7 years, repeal and replace Obamacare. And I actually. And if you're gonna give us another healthcare plan, that would be great. But I don't think they're going to do that. What they are doing, what they did was, after the Democrats gave people what they wanted, healthcare, at least some people, the Republicans said, well, that's ridiculous. It costs too much, and it did cost too much. And they said, well, we can give it to you cheaper, which is what they'll always say. If somebody else does something, if the Democrats do something, which is how it goes, the Republicans will say, well, we could have did that same thing for cheaper. Well, you didn't do it before, and then they're not doing it now because they can't even all agree. It's going to be a bloodbath in the midterm elections for the Republicans. If they cannot get this right, they should be able to easily get a bill out there. Love it or hate it, they should be able to get something out there to say, look, we said we're going to do this when we did this. And the Trump administration can't even seem to get any traction on healthcare because of Russia dominating the news cycle. So even when people are looking, Fox News, CNN, MSNBC, and they're looking to see what's going to happen with healthcare, all they're seeing is a collusion with Russia, Trump Jr. and Jared Kushner and Paul Manafort. You don't hear anything about barely anything about healthcare, and what you do hear is it's not going to pass. You got Republicans voting against it. When the Democrats passed their healthcare bill, they were concerned about who are we going to bring from the other side of the aisle. When the Republicans are trying to pass their healthcare bill right now, they're concerned about who are we going to keep from leaving our side of the aisle. It's a much different political climate now this time for trying to pass this bill. I don't think it's going to get passed.
Well, let's refresh our memory just a little bit and play a couple of videos in response to the Supreme Court ruling and over the conversation between a penalty and a tax code.
I mean, there is some irony here where Democrats were running away from the idea that it was a tax when they passed the law, and now they've been sort of bailed out by this argument constructed by, ironically, a Republican appointee, Chief Justice John Roberts. It's actually not the argument that they really wanted to make to the public, but it's what saved them. But, I mean, they vacillate a little bit on their position, I think. But in both cases, each side has been pretty clear on the policy. Obama will defend this law. He's happy it was upheld, and Romney wants to repeal it. It's not clear whether he will be able to. It depends on what happens in Congress. But I think the average viewer at home, number one, they're probably not going to pay any tax or penalty as a result of this law. Number two, it's a pretty clear choice. If you vote for Obama, the law is going to stay in place and probably be strengthened and evolve a little bit. If you vote for Romney, there's going to be a full frontal attack to repeal it, and he might succeed. And that's the choice we're in now. So the rhetoric is sort of flip-floppy, I suppose, but the positions are actually pretty clear.
So the Solicitor General tells the Supreme Court, representing the Obama administration, it is in fact a tax. It'll be administered by the IRS. It'll be collected on April 15th. Why can't you acknowledge that it is in fact a tax?
Because it's a penalty. It's not a tax. It's a penalty that if you decide to be irresponsible and continue to refuse to carry health insurance and make us all pay for your being irresponsible, then you can do that. We're not going to actually require that you have health insurance. What we're saying is if you choose not to carry health insurance, then you will be assessed a penalty that will be assessed on your tax return, and that affects about 1% of Americans who choose to do that.
And one last comment from 2009 from Obama himself.
It's a big day for the court behind me, for the White House, and especially for millions of Americans without health insurance. We're not losing track of them tonight. But because health care reform, which the Supreme Court affirmed today, was President Obama's signature political accomplishment, and because the court's decision comes in the middle of a presidential campaign, the political dimension is more than just unavoidable. It is epic. And so is the legal angle. Few expected the individual mandate that people buy health insurance or pay a penalty would survive. Fewer still expected Chief Justice John Roberts to save it, or to save it the way he did. Writing for a 5-4 majority, he latched onto the penalty part, calling it a tax and deeming that constitutionally kosher.
I know the debate over this law has been divisive. I respect the very real concerns that millions of Americans have shared. And I know a lot of coverage through this healthcare debate has focused on what it means politically. Well, it should be pretty clear by now that I didn't do this because it was good politics. I did it because I believed it was good for the country.
Well, we can tell from these videos going back from 2009 to 2012 that the conversation hasn't changed much. We know now that it is a penalty, and we also know at the end of the year when we go to file our taxes that either you pay the penalty or you have shown from your IRS record, from your tax documents, that you have paid into some sort of health care premium.
Right.
And if you don't pay that at the end of the year, you know that if you go 2 years without paying it, well, in case those who do not know, if you go 2 years without paying it and you own property, they can put a lien on your house.
Right.
And if you go 2 years without paying the penalty, then that also means that they can revoke your driver's license as well until that's paid. And that's where the law stands. So the conversation hasn't changed too much between the two aisles, between the Republican and Democratic side of the legislature. So going from there, where do you think the conversation will go with the Repeal Act?
I think it's quite frankly and sadly going nowhere. People are dug in, and the Republicans are. I feel like they're content to let Obamacare quote unquote blow up on its own, or run out of money, or whatever they want to call it. But I don't think it's going anywhere. I don't think we have a new bill coming at all. I think there may be some kind of bill to come out where the Democrats and the Republicans will work together in some kind of kumbaya moment. It's not. It will probably in my opinion be after the midterms. I think they're going to drag their feet, kick the can down the road until the midterms and see what happens. And let's dissect something that you said. Okay.
You're talking about the inequalities. I keep saying inequalities. You're talking about, number one, the tax credits. The tax credits have run out.
So they're saying that their program's running out of money for this
because
reason or that.
We're no longer providing tax credits at the same rate as we did under the Obama administration. The Trump administration, you can call it the Trump, some people may call it the Trump legislature, being that's a Republican majority in the legislature. So we see that the tax credits have been dropped from a lot of folks who can no longer afford it, because in the past, the government, the federal government, also, and states help fund it, but mainly federal government, help fund those tax credits.
Right.
To individuals who could not afford a full premium.
Right.
And we're within a certain tax bracket. But let's also make certain people understand that that's very different than Medicare and Medicaid.
It certainly is.
Yeah.
It's a very complicated
issue. Because you have to work, you have to make more than $800 a month in order to qualify for the Obama, I keep saying Obama, but the Affordable Health Care Act.
Affordable Care Act, or Obamacare. Mm-hmm. You do have to. But it is through an employer. So it's set up that way. They took it from the old way where employers did it out of the goodness of their own heart,
and
or
you
just
only
from
got
being
one or
decent
two options
people.
On what you choose from. But now it created a whole marketplace that you can be able to exchange within different states.
Well, no, not necessarily, but that is being proposed, which I do like. You can't. Some people have less choice. Some people had more choice and now have less.
Depending on if their employer gave them option and provided, or they could go outside of the employer and be able to pick and choose their own through the Obama Health Marketplace.
You can go straight to the healthcare.gov, or you can go to, but it does depend on what state you're in. Some states only have one choice. But really, what we're saying is we have one choice of who we're going to give money to instead of the doctors to keep us healthy. Mm-hmm. And I think that's ridiculous. I think we need to just, I keep saying this, but insurance companies are the problem. And we need to, but they have a stranglehold on Washington with lobbyists, and they're worth millions of dollars, and you're not in a $1 billion industry. So to say that we're going to change anything, or the Republicans are going to change anything, first of all, if the Republicans are going to change anything, that's almost a joke. And for the Democrats to change something, they have to take over in Congress. I don't know that the Democrats, as they stand, are competent enough to do so. So I think the people who are going to suffer are the American people, unfortunately.
Well, let's talk about the American people when we come to the inequalities of the Affordable Health Care Reform. Number one, or as someone may say, the Obama Tax Reform Initiative. So let's talk about the Health Care Reform Act. So the inequalities, number one, are high deductibles. High deductibles that cost between $6,000 to $8,000 a year. And that is just astronomical. Think about the average person cannot meet a $6,000 to $8,000 deductible. Their plan without a tax credit could be $600 or $700 a month, besides the deductible just to pay for premiums. So one of the big issues that we're talking about, folks can't afford it, like they did under the Obama administration. Those tax credits have run out. So the second thing that we find is a big problem for the Affordable Health Care Act is some people have insurance on paper only, meaning that because of the high deductibles, they're not able to use it.
Right.
You know, they have to meet the deductible or go in and pay out of pocket, depending on whether they went with, depending on their plan, the type of plan that they have to pay out of pocket because they haven't met their deductible yet.
Well. So, and you're exactly right. It's the Obamacare has helped a little bit, but people are still going into debt when they have a big problem. They have to pay that huge deductible of $6,000, $12,000 that people don't have.
So, and let's also talk about this, the tax penalty. So some individuals, I don't know, misinformed or were not informed enough, but the tax penalty was more than they had anticipated. When we hear in the media, $800 to $1,600, well, we're talking about the difference between individuals and families, mm-hmm. and individuals that could be single with dependents versus those who are married, where you get a larger tax credit than those who are single with dependents or married with dependents. And those separate away from that, a third category are folks like myself who are completely single. The other issues that we have are the expensive cost of prescription drugs, which companies have kind of, been in this gray area saying this is because of health care, but really because this has become a business game for insurance companies and pharmaceutical, and not, well, I wouldn't even say pharmaceutical companies. We're talking about insurance companies.
Well, I think it's in combination. They're in concert.
Yes. And then we talk about not just the expensive cost of prescription drugs, that a lot of pharmacies are benefiting from the higher cost, receiving more money to use generic drugs by generic companies to compete with those name brand prescriptions, those name brand drugs. So the generic versus name brand drugs is part of the game today. It's part of the game because it is truly a game.
It truly is. And again, the people who suffer are the American people. People in Canada don't suffer. People in Mexico don't suffer. As far as prescription drugs go, that's where we go to get them for cheap. And the FDA they say that it's better for us. They make sure that we're not getting any pills that are made out of drywall, and they're saying it's Tylenol, for example, which is fair enough. But at this point, the pharmaceutical companies and the insurance companies have taken advantage of that, and the prices of drugs have ballooned, and the prices of care has ballooned. People just can't afford the drugs. We are forced to get illegal drugs a lot of time from Canada and Mexico.
Well, with that said, let's talk just a real quick minute on the inequalities of the Republican care. Under this program, they have criticized the Obama health care initiative. Republican legislators like McConnell have come out and they said, hey, the real big issue that we have here is let's fix what's wrong with Obamacare before we jump on this new bandwagon and don't know what are going to be the inequalities in this program. We know what doesn't work with Obamacare. Let's work with that and come up with this compromise. I think what you were alluding to, that we will see maybe after the midterm. But the new program says that they're going to solve the issue with the deductible and then go to copays. And then there comes a problem with low-skill labor class, second, third class individuals who can then not be able to afford to go into a clinic or into the doctor's office because they have to pay a copay, a deductible, and then a premium. And then we have the issue with the drop of long-term individuals or people with pre-existing conditions from the old Obama healthcare marketplace type of program.
Which they're saying they're not going to drop anyone with pre-existing conditions. That also, I'll believe it when I see it. Like I said, the CBO score comes out next week. We'll see what it says.
We'll see where it goes. Torvin, can you take us out to our third segment?
Of course. Well, my name is Torvin Pristel. I'm here hosting with Carrie Smith, the Verb Altitude Hour. You're listening to WRUU LP Savannah, Georgia, 107.5 FM, WRUU.org. We are Savannah Soundings Community Radio with a global soul.
This portion of WRUU LP Savannah Soundings programming is made possible by a grant from Sentient Bean, offering fair trade coffee, vegan and vegetarian food, and breakfast all day. Located at 13 East Park Avenue, across the street from the tennis courts at Forsyth Park. Our menu and special events listings can be found at sentientbean.com. WRUU Savannah Soundings Community Radio announces its second annual online auction. The auction will run from July 17th to July 30th, with proceeds going to Savannah Soundings Community Radio as an investment in the diversity of our community voice and music. The wide range of auction items from Savannah businesses will guarantee to delight and surprise. To join the online bidding fun, follow the link found at wruu.org.
All right. This is Carrie Smith on WRUU Savannah, Georgia 107.5 FM, WRUU.org. We are Savannah Soundings Community Radio with Global Soul. Torvin, we spent the first two segments talking about first the history of affordable health care in this country and the inequalities leading up to the Obama Health Care Act and then the Repeal Act. As we say, the repeal and replace. So we're bringing on my dad in the third and fourth segment discussing Obama healthcare. Hey, Dad.
Hi, good morning.
And my dad, to the larger WRUU audience, is Barry Joe Smith. Daddy, could you introduce yourself?
Yes, my name is Barry Joe Smith, and I reside in Squatch County, Tennessee. Been lived here all my life, and helping my daughter Carrie, and I want to hear what you all got to say.
Well, nice to meet you, Mr. Smith.
This is Mr. Torvin. Daddy Torvin just had a new little girl who's 2 weeks old. I get Thursday.
Yeah, 2 weeks.
2 weeks old Thursday. So.
Oh, new daddy.
Mm-hmm.
Oh, that's good. I can see what he's going to be doing over the next few years.
You can see why healthcare is a big thought for Torvin and his family.
Definitely important to Miles.
For his family and all the other people live in this nation of ours.
Daddy, let's get started here. You've been a recipient of Medicare.
I have a recipient of Medicare since April of '88.
Okay. Now, Dad, I'm gonna ask you something here. Could you share your story with us regarding the what you went through in response to administrators and doctors' offices not being able to understand the process of the new Affordable Health Care Act and how that's affected you when you went to the doctor? And I know you had a little bit of an issue when they wouldn't take your Medicare. Now, we know that those are two separate things, but the lines got blurred when you went to the doctor within the last few years.
Well, the trouble with not really going for per se medical, but it affects those that are the diabetics more than it does anyone with Medicare. They used to pay for all your diabetic testing supplies, and they also used to pay for you to go to a podiatrist, because anyone with diabetes has to have, just about everyone will have a problem with their feet. That's the main thing, because starts out with diabetes is, having a problem with your feet.
Mm-hmm.
And insurance used to pay, Medicare used to pay for you to go to a podiatrist. They'd even want to cut your toenails, they'd check your feet, and see if they were dry, this and that, Mm-hmm. But now, doctors, even podiatrists, won't hardly write your prescription for diabetic Qs, which Medicare would pay for a pair every year,
Mm-hmm.
Get a pair of, it would pay for one pair a year and 3 pairs of insoles. Well, they don't do that anymore, and I don't know the average number of people in the United States that's diabetic, but I would say over half of people with diabetes will probably have a problem with their feet sometime in their lifetime with it. So it's really important to keep that, but I just think that healthcare has got away from a lot of things that they used to cover, and I think it's all about the money. And
it's funny that you say that, Daddy, because I remember you had a run-in where you went to the doctor and the young lady kept asking you to pay out of pocket, and they weren't applying it to your Medicare. And
yes, that was so, and I said that if you of course, with a lot of people with Medicare, if that's the only insurance that is their primary insurance.
Mm-hmm.
But now with mine, that's my secondary, and a lot of times they will go with the primary insurance and forget to go with Medicare to pay the secondary part of it. But you usually will pay 100% on everything after the primary takes care of the first part. And that's the big thing, is taking the time and doing it right. And all you have to do is, file it right first time. Then no insured person will have a problem with getting a letter in the mail that you got to pay so and so, or having to pay out of pocket.
Right, and we also had an issue. Didn't you also had an issue with under my mom, Jan Smith, your wife, or Virginia Smith? She is a government employee, so her insurance has switched to more generic drugs, and it's affected you as as that being your primary health insurance, that they switched your diabetes medicine, correct?
A lot of that, a lot of insurance is not just about all insurance companies anymore will pay better if you use a generic drug. They want you to use a generic drug first. But now with some diabetes patients, you take a drug that's only been out for just a while. You know, a drug has to be out for several years before they make a generic drug for that.
So did you feel like you had a better option?
A lot of your co-pays don't want to pay as much on the higher cost of a drug that don't have a generic offer.
Torvin was wondering, was that was your only option? You didn't have an option but to go to generic drugs under Mom's plan, correct?
Well, that's true. That's true. Now, her plan is state by state. It's not a federal. It's it's like the state of Tennessee. Even though it's government, that's state by state. You know what I'm saying?
Mm-hmm.
It's not federal controlled. So
correct.
There's a little more leeway when you go state by state insurances like that.
Okay.
So.
Okay, Daddy, we're going to get in it. I think that is a lot of good information that a lot of people don't have out there. We're going to spend the last few minutes as we get into our fourth segment. We're going to go ahead and close out this segment. And we've been talking about, number one, how, this has affected local individuals and having to deal with some of the quirks from all these changes to the healthcare system, both not just as we're seeing just in the Obama healthcare initiative, but also in Medicare and Medicaid, and how insurance companies are changing some of their requirements and working with the government. We talked about just different levels here. Well, we're going to sum all this up and talk about some other initiatives that entrepreneurs and the citizens themselves have used in the fourth segment. Torvin, will you close this out one more time to the fourth segment?
I certainly will. My name is Torvin Prestel, here with Carrie Smith, hosting the Verb Altitude Hour, and you are listening to WRUU LP, Savannah, Georgia, 107.5 FM, WRUU.org. We're Savannah Soundings Community Radio with Global Soul.
WRUU Savannah Soundings Community Radio announces its second annual online auction. The auction will run from July 17th to July 30th, with proceeds going to Savannah Soundings Community Radio as an investment in the diversity of our community voice and music. The wide range of auction items from Savannah businesses will guarantee to delight and surprise. To join the online bidding fun, follow the link found at WRUU.org.
We're back to Savannah, Georgia on WRUU-LP 107.5 FM, WRUU.org. We are Savannah Soundings Community Radio with Global Soul on the Verb Altitude Hour. I have my daddy, Mr. Barry Joe Smith. Everything I learned from him himself. Daddy, thank you for being back here for our last segment. And Torvin?
It's fine. We're proud to help.
Thank you.
Of course.
So we only have just a few minutes left, and we're going to close out within the next a few minutes here. But we wanted to educate just very briefly on some of these other alternatives to deal with the inequalities in both actual the Obama healthcare program, or as we call the healthcare marketplace, and the American Repeal Act. So, first of all, we talk a lot about single payer deductibles. Mm-hmm. Torvin, what are your thoughts on the single payer deductibles?
I do believe single payer is Well, it would be complicated like any other system, but I do believe it would be the best way forward to take insurance companies completely out of the equation and have the government regulate healthcare for every American at a fair, reasonable price that everyone can share.
Daddy, what do you think about having an option for direct payment clinics for those like myself who have my own healthcare savings in my own bank, being able to pay out of pocket? I know in Nashville, you and I talked after a conversation I had with some pharmaceutical reps that doctors in Nashville now have the option to allow you to come in and pay out of pocket. What do you think about that?
Well, for some, I don't know the amount, but now for some people that works good.
Okay. Well, go ahead.
But there's a lot of people out there that don't have the money to do that, and they solely lean on insurance itself to take care of everything.
That's true. That's true. Because it is hard, besides just paying a premium, that we forget how difficult it is just to have the money, not just to pay for the premium, be able to walk through the door. And we talk about co-pays and being able to pay a deductible or paying out of pocket till the deductibles are met. I know we talk about what my mom within the last year have had to get procedures done, and she's had to pay for those out of pocket. Now, that's the traditional way that we should think about doing it, but it can be hard on families.
That there is a lot of it's due to the doctor's offices themselves and not putting the right code on a procedure that a doctor prescribed to start with.
Very good. So other options may also be looking at the concept of crowdsourcing, where LPNs and students can work in clinics, being able to supply their time and provide it at a low to almost nothing cost. Also, we've also talked about pharmaceutical reps have told me, and I talked with you about this the other day, that now they offer options because people really need certain drugs to just be able to live, that they need name brand drugs, that they can call a company in order to get these drugs at a baseline cost.
Yeah, that really is a problem because in our United States we have some people that will try to go to Canada and buy their drugs, which are a lot cheaper, but I think the biggest thing about our healthcare system, when they come up with a to vote on something, before they put it into effect, they need to fund it like they do education before they completely put it in perspective. You know what I'm saying?
I do. I think
funding is the main thing whenever they go to come up with it's just like with Obamacare, which it was great for a lot of people, but they had problems with the funding over several months when they first put it in perspective, and I'm sure with the new one that they're trying to come up with, that it will probably have the same problems. That's my opinion anyway.
Correct. Well, we're going to go ahead and close out on that, Dad. That was a good conclusion. I think that was really, really good. I think you.
Yes, we just need to try to keep politics out of health care, and the main thing is fund it before you put it in action.
I can't say it. I don't think anybody could say it better. Do you think so, Torvin?
Well, I do not, even though far-fetched it would be to keep politics out of healthcare.
Yeah.
To say it like Yoda would say it, I guess. But, I think that would be a good start.
Right. Well, this has been the Verb Altitude Hour on WRUULP Savannah, Georgia, 107.5 FM, WRUU.org. We are Savannah Soundings Community Radio with Global Soul. The following program contains subject matter and realistic language that some listeners may find objectionable. Listener discretion is advised. The viewpoints expressed in the preceding program were not necessarily those of WRUU, its license holder, or its staff. Have a great week, folks. We'll hear you back here at 5 o'clock on Saturday on WRUU.org. And this has been Carrie Smith, Torvin Prestel, and Barry